Chapter 10, Delegation, Leadership, and Management. Okay, so the chain of command. It's important that you learn and understand your organization's chain of command. It's the organizational structure of your facility. So who's your supervisor? Who's your supervisor's supervisor? And so on and so forth, going up the chain of command. Also understand sometimes maybe you have to go to a different person for your scheduling issues outside your supervisor, or maybe you have to go to a different person for certain concerns or complaints or issues or things like that that's going on. So you know, if you got to call off, is that your supervisor you call or is it somebody else you call? So, it might not always be your supervisor with some of these other particular issues come up. So you need to understand those things as well. Who do you call for this and whatnot? Okay, so there's several different types of leadership styles. Different people are going to have different types of leadership styles. So you need to understand, the different types um, and what your leadership style will be. Because at some point you may, if you're at a job long enough, you may very well, get promoted to charge nurse or something like that. Or if you go on for your further your education, maybe even higher up leadership positions um, as well. So different types of leadership styles: laissez-faire, autocratic or authoritarian, and democratic leaders. When we talk about a laissez-faire leader, that person does not attempt to take control of the team. So they offer little input. They don't provide any direction. They don't, um, let you know what the goals are. They assume everybody knows what to do, and that person wants to be liked. So they're not gonna do anything. They're not gonna, it's never really a good time to use laissez-faire. The only time a laissez-faire leadership style might work is if you have, say, a group of independent physicians that know what to do and don't need a lot of guidance. But however, still in that situation, we all still need to know what are our common goals, what are we working towards. So, it still probably wouldn't even work because, what are our goals? And this person doesn't provide that for you. Autocratic, it could be called autocratic or authoritarian. You might see it either way, autocratic or authoritarian. And so that person tightly controls the members. It closely monitors the staff, so they might even be one that micromanages. They don't get any input from the staff. They make the decisions and they tell you this is what you're going to do, and don't accept any input from the staff. You do this, and that's just the way it is. No input from you. And so, a time when an autocratic leader might be effective is in an emergency. So, for example, if we have a code, we need somebody to take charge, take authority. And so, you can say, you do this, you do this, you do this, right? I don't need any input from anybody. I just need you to do this, you to do that. That's the time when an autocratic leader might be effective. And then your other leadership style, democratic leader. And so the democratic leader, so they frequently consult with the staff members and they seek input. So the democratic leader will make the final decision. However, they're going to get everybody's input before a final decision is made. And when they're contemplating that final decision, they're going to take everybody's input into consideration. They like to promote an atmosphere of respect. You respect me, I respect you type thing. And we all working together. They provide clear goals, clear direction for the team members and everything. And so we're, all working together to achieve our common goal. Okay, so these are just some attributes that a good leader might possess. If you think about it, these are just all attributes you would want in your leader. You would want somebody that's open-minded and willing to listen to you and take suggestions and things like that, not just closed-minded to and don't want to hear any new ideas or anything. So you want somebody that's open-minded. You want somebody that's consistent. You don't want somebody that's treating this person one way and treating another person another way or whatnot. So you want somebody that's consistent, somebody that's responsible, somebody that can teach you. If somebody, you got a supervisor don't, know the job and can't teach you, that can be frustrating or whatnot. You want somebody that's a good problem solver, have a sense of humor, because although we are at work and have to conduct business, we still want to be able to enjoy our environment. Somebody that has good clinical skills. They're sensitive, objective, they're flexible, decisive, meaning they can make decisions. They're calm, assertive, and articulate. So assertive meaning, not aggressive, but yet not a pushover. Um, somebody that's fair, there's organized, considerate, tactful, and a good role model. These would all be considered, good attributes of a leader. And like I said, if you think about it, these should be attributes you would want to see in somebody that's leading you as well. Okay, so these are some keys to effective leadership, which we're going to discuss in further detail here in the coming slides. Collaboration. You want somebody that is able to collaborate with others. So that means they're able to work well with others. You have a whole healthcare team. Your healthcare team is not going to just consist of nurses, it's going to consist of um, physicians, dietitians, therapists, pharmacy. Um, when we talk about therapy, you got OT, PT, speech. Also, a part of that, you have to collaborate with the patient and their family as well. So you want somebody that is able to be able to collaborate with a wide variety of individuals. You want someone with effective communication skills. Effective communication means that they can be direct, like we said, so they're assertive. So assertive being not aggressive, but not um, passive and letting people run over them either. So they're direct, but they're respectful and they're tactful. And they are specific in their communication. There's no ambiguity when they communicate with others. You want someone with clinical competence and confidence, right? So competence and confidence is going to come with the more experience you have. As a new nurse, you may not be that confident in your skills and your knowledge, but with the time and experience, your confidence and your competence should become more efficient. But in a leader, we want a leader that is competent and confident in the skills uh, that they have. And so it should come across when they're performing their work as well. You want somebody that is, able to admit when they've done something wrong uh, or when they don't know something. It's okay to say you don't know something. One person is not going to know everything. One person just won't know everything. And so it's okay to say you don't know something versus make up a lie about an issue as well. And so organization, you want somebody that is organized. So to be organized, you have to be able to plan each day carefully. Be flexible because unforeseen circumstances can occur. You have a patient turn critically ill or a patient that falls or different things that happen. issues that come up that you have to tend to or whatnot. So unforeseen circumstances, but plan out your day, have a plan with things that you prioritize, things that have been prioritized, but know that that plan can change if things in the day change. Organization also means being able to make decisions quickly. Being able to divide the patients and assign tasks. So delegating appropriately, knowing how to delegate and who to delegate to appropriately as a leader, right? Also, so bringing that up, delegation is something that, you know, will make a effective leader when we're talking about nursing. And so we're going to talk about delegation. Delegation basically means to assign tasks to to other individuals to be able to perform. Um, so we're going to talk about those here in the upcoming slides. What delegation is. Okay, so we said delegation is assigning tasks to other individuals. So as an LPN, who can you delegate to? You can, as an LPN, you can delegate to unlicensed assistive personnel. Also, you can delegate to other LPNs. So in some long-term care facilities, you very well may be charge nurse or whatnot. So you would be delegating to other LPNs as well. So you can delegate to unlicensed assistive personnel. So unlicensed assistive personnel will more than likely be your nursing assistants, your aides or whatnot. But that can also be the unit secretary, that could be the housekeeper or whatnot as you're delegating to a task to. Obviously, you're not going to be delegating nursing tasks to those individuals, but for the most part, the main person you'll be delegating to will be, when we're talking about unlicensed assisted personnel, will be your aides or nursing assistants. Um, you want to, when you're delegating, first of all, you want to know what the law says you can and cannot delegate. So what does the law say you can and cannot delegate? Um, Also, then you want to know what your facility says a person can or cannot do. A facility can make stricter policies, but they cannot make more lenient policies. So, for example, um, the law says that a state tested nursing assistant can perform vital signs on a stable patient. However, every facility does not necessarily allow their state tested nursing assistants to um, perform vital signs on stable patients. So you need to know what the law says the person can do and then what the facility says the person can do. Additionally, you need to make sure uh, that that person is competent. So, yes, aides should be able to perform uh, a Hoyer lift, transfer a patient using a Hoyer lift. However, if you delegate to an aide and say, please assist Mrs. Jones to her chair via Hoyer lift, and the person says, oh, I've never used a Hoyer lift before, I'm not sure how to use it, and you say, well, you're an aide, you should know how, figure it out, then we're all in trouble. And that person goes and lift Miss Jones via Hoyer lift and Miss Jones fall. There's a problem for everybody. So if that person does not know, then you need to find somebody that is capable and knows how to use that Hoyer lift, or B, go with that person and teach that person how to use the Hoyer lift appropriately. And so that would probably be ideal because at some point they need to understand how to do it. So teaching them would be um, a good strategy. Remember, you're still accountable for tasks you delegate. Just because you delegate something, you don't wash your hands of the situation. You're still responsible. So that doesn't mean you have to stand over a person to watch them to make sure they get it done. but it does mean you have to supervise and ensure that it's done safely. So it could mean you're watching them, but it could mean that you go back after the fact to make sure the task was done safely. Or it could mean you go to the chart and see if it was documented that it was done in a safe manner or whatever, but there should be some supervision over that. And if anything was done inappropriately, you need to go back to that person and say, hey, we could do this better, or maybe try doing it this way or something like that to ensure um, they understand how to do it appropriately the next time. Make sure your communication is effective. Don't just say, um, go um, give Miss Jones or do the do the AM care in room 205. Be specific. What AM care do you want done? By when do you want it done? Um, be specific. You want Miss Jones to have a shower and have her clothes put on by 9 a.m. because she has an appointment she has to leave for by 9:30 or whatnot. Um, so be specific. Don't just say go walk Miss Jones down the hall. How far do you want me to walk her? By what time do you want me to walk her? Do you need me to use a cane? Do you need me to report something specifically? And we're talking about reporting. We shouldn't be delegating things that require judgment. If we delegate Miss Jones to have get a blood sugar check, it's not for that aide to determine is this blood sugar critical or not. You need to be specific when you delegate that. So if you say, go, I need a blood sugar on um, Miss Jones by 8 a.m., and report immediately to me if that blood sugar is less than 70 and higher than 130. Um, Otherwise, chart it in the chart, and I'll take a look at it. But be specific. It's not for that aid to determine is this a critical value or not. All they do is perform the task, and that's it. Also, making sure we're not delegating anything that we shouldn't be delegating. Anything that needs assessment, the aides can't assess, they can't analyze, they can't plan, they can't evaluate, and it has to be stable patients. So yes, an aide can feed a patient. However, if a patient has dysphagia, that patient is considered not stable because they're at risk for aspiration. So we're not going to delegate um, that patient to an aide because they would be at risk for aspiration. So only stable patients are we delegating to an aide. A patient that just got out of surgery is not necessarily stable. We need to make sure, we get those patients stable before delegating them. Um, Also, you know, give them praise. Provide praise or constructive criticism on how they performed the task that you delegated to them. It's okay to say please and thank you when you're delegating. Just because you're in a leadership role or a supervisory role or a role that you're delegating, it doesn't mean you have to be mean about the situation. It's okay to say please and thank you. And as you're evaluating, like I said, it's okay to provide praise or constructive criticism on how that task was performed, so they'll know. Um, am I doing a good job, or do I need to improve in some areas so that I can do it better the next time? Okay, this is question one. Jackie is working in a hospital setting. Her charge nurse does not attempt to take control of the unit and offers little direction. Jackie is a new graduate nurse and finds this difficult at times. She knows that this is what type of learning style. So your answer here is going to be one, laissez-faire. So remember we said laissez-faire, they provide no direction, no guidance. Um, they don't give you any vision or goals or, and what you need to be doing. Okay, question two. Denise works in a hospital where her charge nurse consults her staff and seeks participation in decision making. What type of leadership style is Denise's charge nurse exhibiting? So the answer there is democratic. So remember we said the democratic leader is one that's going to they're going to make the final decision. However, they're going to get input from everyone and before they make that final decision and take everyone's input into consideration when they're contemplating their final decision. Okay, so as an LPN, most of the times, many times you'll be working under a registered nurse. A registered nurse has the authority to delegate to a LPN. And so a LPN can also perform any other task that an unlicensed assistant personnel performs. And so as a beginning or new nurse, you very well may be delegated some tasks um, or functions of a UAP or unlicensed assistant personnel as a new nurse until you start to gain more experience and knowledge as a LPN. Now, when you become an advanced nurse or LPN with more experience and knowledge and skills, your tasks or duties will be increased, and you very well may be appointed as a charge nurse. Like I said, many long-term care facilities have their LPNs as charge nurses. And so that may be a role you take on when you become more experienced. Okay, so these are just some time management skills that we're going to discuss here for that not time management, some management skills that LPNs may require as they do take on more leadership roles in nursing. Being able to manage your time, use a computer, receive new orders, take verbal orders, and document for reimbursement. So we said in the beginning that as a leader, one of the skills you're going to need is time management skills. And so you need to have effective time management skills. As a leader, as a nurse, period, whether you're in a leadership role or not. But even if you don't have an official leadership role, you'll still have some leadership duties because you'll still be delegating to UAPs, unlicensed assisted personnel, as well. So, as with time management skills, you need to make a to-do list. So, what are my priorities? Things I need to get done. Um, and sometimes some of those things are going to be time flexible, and some of those things are going to be time fixed. And so, time fixed being um, say for instance, my meds are due at 9 a.m. So I have to get those done at a certain time. Now you're going to follow your facility's policy because some facilities, it may be an hour before, it may be an hour after. And so you have that window from if my meds are due at 9, I have that window hour before 8 a.m. to an hour after 10 a.m. to get those meds done, but they're time fixed and I still have to get it done within that time frame. Some facilities or even units in a facility may be 30 minutes before, 30 minutes after. So just follow your facility's policy as far as that goes. When we talk about time flexible tasks, time flexible, I don't have to get it done at a certain time, but I do need to get it done. So for example, um, your dress and change may say get it done on first shift. So I don't have to get it done at a certain time. I just have to get it done within my shift. And so that's a time flexible task. And so things that can go into that. Um, do I need assistance? Do I need somebody to hold the patient? So do I have that person? How long is it going to take me? If I got to start meds at 8 a.m., do I want to start? And this dress and change usually takes 45 minutes. Do I want to start that dress and change at 7:45? So, taking all those things into consideration. Again, planning for uh, uh, the unexpected. You have a patient fall. You have a patient take a turn for the worse. Different things can come up. You also have to get your charting in during that day. So make a to-do list. Start checking things off that to-do list as you go throughout your day. And then at the end of the workday, you want to go back and evaluate the effectiveness of your time management. Did you manage your time well? What things can you do better for the next day? And what things worked well for you? Okay, so nowadays in healthcare, there's probably very few places that you'll be able to work where you won't have to use a computer at some point in time. So you need to know how to effectively use a computer. Now, your facility specific system that they use, they should provide some training on how to use that specific system um, to get things done. But a lot of different things can be put on the computer. That's where the physicians are gonna put their orders in if they have computerized order entry systems to put their orders in. Um, Also, the different departments can use the computer to order supplies, order medications, order, different things like that. If a person has a lab ordered and the lab gets done, the lab person is going to put the lab results in there. If they had diagnostic tests, they're going to put those in there. If we're scheduling surgeries, all of your notes, your nurse's notes, your physician's notes, your dietary notes, therapy notes, all those things, your nursing care plans, your MAR, your medication administration record, and your TAR, your treatment administration record. And this is where you're going to track your patients' acuity levels. Are they getting better? Are they getting worse? So you're going to there's probably very few places that you can work now in healthcare that you're not going to need to be able to use a computer. So um, if you need to take a class for some computer skills, that could be helpful too if you're not, good with using computers. Okay, so receiving written orders. So receiving written orders. Um, so a lot of facilities now, like I said, everything's going to be computerized. So some facilities have the computerized provider order entries, and that's where the physician can simply it's a system in the computer where the physician can put the orders in, and then you, as the nurse, will need to receive all the orders, verbally communicate any stat orders, stat meaning immediately. So you want to verbally communicate that to the person that needs to know and implement that right away. And then acknowledge each order that's written and verified by the pharmacist. Now, what do you do if an order is not clear? If the order is not clear, then you need to contact the provider that wrote the order to get a clear understanding of, what's to be done. If you Now, I know as new nurses, sometimes it's difficult to question the doctor or whatever, but you have to remember you're your patient's advocate. If a doctor orders something and you say, "Oh, I've never seen that used for this patient's condition," or "that seems like a large dose," you can call the physician and say, "Hey, did you mean to write da 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 da?" Get some clarity on that order. And then if the physician gives you a response that you're satisfied with, then you say okay, and you can go ahead and continue and perform the order. If you're still not okay with that order, you have a right to refuse that order, and you have to document why you refused it, and then you have to talk to your supervisor and let your supervisor know you refused it and why you refused it or whatnot. If it's something that you feel could potentially be harmful to your patient, you have a right to refuse to administer that order. So you have a right to question the doctor. And like I said, I know as a new nurse, sometimes that can be hard and difficult because you too are probably questioning yourself and not sure. If you are questioning yourself, make sure. your drug book is your best friend. Look it up, and talk to your supervisor, talk to your coworker, and make sure you're on the right page, and then call that physician and get it clarified. But you always want to call and clarify any orders that you are unsure of. Okay, taking verbal orders. So nowadays, especially since we've started with the computerized order entries, the Joint Commission actually discourages verbal orders or telephone orders unless it's an absolute necessary emergency situation or something like that. Um, some facilities don't even allow verbal orders or telephone orders anymore, and the physician has to actually, put the order into the system, the computerized order entry system or whatnot. But if you are taking a verbal order, and then also keep in mind too, some places only, if they do allow verbal or telephone orders, they only allow their RNs um, to take those verbal orders or telephone orders. So, but if you are in a facility where you're having to take a verbal order or a telephone order, you're going to enter the order on the physician's order sheet exactly as the physician said. You want to enter it exactly as the physician stated. And then you want to repeat back what you wrote to make sure you wrote it exactly as they said. As they said, you're going to mark it VO for verbal order or TO for telephone order. You're going to date, time it, and put your first initial and last name in your designation, professional designation, so LPN or RN after it. The physician has to sign that verbal or telephone order as soon as possible. Usually it's within 24 hours, typically. So, but they got to get that verbal order signed as soon as possible. So if you recall back to when we completed the documentation chapter, we said one of the things that documentation is used for is for reimbursement. If it's stated that, when they're coding your patients and they coded, we're treating this patient for um, uncontrolled congestive heart failure or something like that or whatever, but none of our documentation shows that we're treating the patient for congestive heart failure, then they're going to say, well, what are we paying you for? And take that money back. So you have to be documenting to ensure you get reimbursed appropriately. Your documentation, they're going to go back and look at your documentation to ensure. So all your nursing care and equipment that you use, it has to be documented. Um, and because that's how your reimbursement is going to be depend on that. All right, so risk management. What is risk management? It's the process of identifying threats that could harm the organization, the patients, the staff, or anyone else within the facility. And so, with risk management, um, the different places, might have uh, a client safety officer, some hospitals or whatnot that are performing risk reduction activities. So they're going to go through, analyze any trends. So is this unit have a high risk of falls? Does this unit have a high risk of infections or medication errors or whatever the issue might be? And if so, then they're going to put some policies and procedures in place to decrease those risks. And decrease those potential adverse effects or sentinel events. Remember, we said a sentinel event is anything that causes serious injury. It could be death, it could be a serious injury like they lost a limb, or a serious physical injury, or a serious psychological injury, or something like that. So we're trying to prevent those things from occurring. So you want to ensure that you are following your agency's policies and procedures appropriately, And then, any complaints that the person might have, you want to make sure you're tending to those complaints as well to, decrease risk for litigation or anything. Okay, question 4. As the charge nurse in a long-term care facility, transcribing written orders is a daily task. When transcribing written orders, it is important to remember, and your answer here is going to be 4. All orders written preoperatively are considered canceled at the time the patient enters surgery. Question 5. Janice, a new LPN, wants to make sure she is taking telephone orders properly. She knows it is important to do all of the following except, and your answer here is going to be number 2. Write the order as close as you can to remember the physician's orders. Remember, we said that we're not going to write it as close as we can. We're going to write it exactly as the physician stated. So you want it exactly as the physician stated.